being here. They're going to speak shortly to their experience and why it's important that children 12 and up take advantage of the opportunity they now have to be vaccinated. And so we're going to have plenty to discuss with respect to COVID. I did want to start with the weather. As you know, it's raining now, and it has been off and on for several days, but particularly in southwest Louisiana and Baton Rouge day before yesterday, torrential downpours, a lot of flooding. That rain is going to continue over the next 18 hours or so here in southeast Louisiana with 2 to 4 inches of rain and some locally higher in areas. And then tomorrow should start to dry out in Baton Rouge, but the system is now going to be moving west as opposed to moving east. And so there will be another 24 hours in addition to the day when southwest Louisiana and the Lake Charles area will be receiving more rainfall, exactly what they do not need, given all the rain that has already fallen, the ditches, the streams, the creeks, the rivers, and drainage is also being impaired by a southeast wind. And so these bodies are not able to empty out as they normally would. And so all of this spells for real problems, especially if we get more rain than has been forecasted, which is obviously a real possibility. That's exactly what happened a couple of days ago. That rain was far in excess of what had been forecasted. So all of this means, please pay attention to the news, to the Weather Channel, to local officials. Make sure you're monitoring the situation, you heed warnings, and do not go out and drive in a flash flood environment unless it's absolutely necessary. And then when you do not drive through standing water if you're not 100% sure that you can do so safely. Flash flooding is going to be a serious threat, and this is not academic. Of the 5 confirmed deaths attributed to this storm event over the last couple of days, we know that 4 of them were related to driving through high water. So please make sure that you don't do that. Turn around, don't drown. And before you leave home, go to 511la.org. It's got the latest real-time information about road closures and road conditions. The Louisiana National Guardsmen currently has 349 guardsmen activated in support of the flooding and inclement weather response. They have deployed 79 high water vehicles and 18 boats. And they have conducted numerous search and rescue missions, and they'll continue to do that as necessary. They also have a L&O team, a liaison team at Calcasieu Parish for support that we expect due to continued rainfall there. As of this morning, there were 109 people in shelters, 87 of those in Lake Charles, 22 in Baton Rouge. Anyone out there needing shelter now or in the future, in the next day or so, if you have flooding because of the rains, please contact your local Office of Emergency Preparedness. And you can get the contact information for your local OEP at the Contact Us tab if you go to getagameplan.org. So go to getagameplan.org. There's a Contact Us tab, and you'll see the number for your local Office of Emergency Preparedness. The safest way to shelter right now, and by the way, the safest way to do anything right now is to get your shot. If you go to getagameplan.org, you're going to see it's #1 on the list. So as we prepare for hurricane season, as we prepare for whatever eventualities we may get, please make sure you're taking advantage of the opportunity to be vaccinated as soon as possible if you haven't already done that. And then we ask you to become an ambassador for the vaccination program in your home, at your workplace, in your church, in your community, with others. If you have received damage from flooding or severe weather this week, we ask that you please report that damage by visiting damage.la.gov. That's damage.la.gov. You're going to be directed to a self-reporting survey. It's really important that you fill it out because this is the information that we're going to be collecting. Local and state emergency managers will use it to help make the decisions about what we do going forward, and if necessary, it helps make the case for federal assistance for our recovery process, because federal assistance is only available to us if we cross certain thresholds in terms of the amount of damage that is sustained here in Louisiana and the number of homes affected. So please go to damage.la.gov if you've received damage from the flooding or severe weather. It is too early at this point to know whether that damage, whether federal assistance will be available. And we continue to work with FEMA every day. In fact, they're embedded with us here in Baton Rouge, and we will be making more information available as we move forward. But it depends on the number of families who are affected, the degree to which they're affected, and whether they have insurance available to help them. And then on the public assistance side, it would turn on whether we actually get to about $7 million in response costs with respect to whether we can get public assistance. And as of right now, there hasn't been a need for any federal assets. This is a fluid situation, not only because we're still trying to determine the damage that's already been caused, but because the rain continues to fall and will for a while longer. And so it is a fluid situation. Switching now to COVID. Today we are reporting 427 cases on 15,129 new tests. The snapshot is that's 2.8% of the tests that I just reported yielded a positive result. Sadly, there have been 8 additional deaths reported since yesterday, bringing the total number to 10,517. As you all know, I keep saying it, I keep awaiting a day when we report 0 COVID deaths. And I know as more people choose to get the vaccine, we're getting closer and closer to that day. And we can make COVID deaths rarer and rarer. But we're not there yet, obviously. Currently, there are 311 COVID-19 patients hospitalized across the state, 27 of whom are on mechanical ventilators. 35.4% of Louisiana's eligible population has initiated their vaccine series, and right at 30% has completed. That's not where we want it to be, quite frankly. Very disappointed in those numbers. We have to do better. The vaccine is available, 3 of them. They're safe and they're effective, and they're at more than 1,500 locations around the state. As you know, the eligible population now includes 12 to 15-year-olds with respect to the Pfizer vaccine. Thus far in Louisiana, 5,275 12 to 15-year-olds have gotten their at least their first shot since we announced your eligibility a week ago. That does not include children who participated in clinical trials. And those trials were conducted in Louisiana for both Pfizer and for Moderna. So that's a pretty good start considering the bad weather that we've had, but clearly we need more individuals to be vaccinated regardless of their age. We've got a long way to go. We do know that with respect to children who've gotten COVID, there are 50,041 of them in Louisiana who have had COVID cases. Very tragically, 7 children under 18 have died from COVID. So as families look at this, sometimes they're tempted to believe there's absolutely no risk to children. That is obviously not true. But secondly, children who become infected are also infectious. And if we're going to stop this pandemic, then we have to stop it. And that means you have to have less people who will become infected and infectious. And so it's really important that we do this. Last week, there was a big uptick in callers to our vaccine hotline with questions about the vaccine for 12 to 15-year-olds. And that is a good development. We welcome questions. It's only natural that people are going to have concerns and questions and things that they want answered. And so we encourage people to ask questions. When it comes to this pandemic, when it comes to the disease of COVID-19, when it comes to the vaccines and vaccinations, there really are no dumb questions. We want them to be asked and answered. And so that hotline is important, and I'm encouraging everyone to use it, and not just to get your questions answered by medical professionals, but also you can figure out where vaccine is available, and they'll even schedule an appointment for you. That number is 1-855-453-0774. They've already, for example, close to 200 individuals have been able to get appointments for vaccinations in their home because they're homebound. So that's the sort of thing that this hotline is set up for. So if you want the vaccine, if you have questions, please give a call. If you need transportation to an appointment, support through Lyft has been made available through the federal government. If you just call 211, you'll get more information for that. But there are free rides available through Lyft to and from vaccination sites. So what's going to happen next is I'm going to turn the podium over to Dr. Cantor. He's going to share some information with you. Following Dr. Cantor will be Dr. McCormick. And I would just ask you that if you have questions for either one of them, please try to address them while they're here at the podium. After Dr. McCormick, Teresa's going to come up with Elise, and they're going to share why they believe it's important for eligible young people to get the vaccine, and then I'll come back up on the other side of all of that. So, Dr. Cantor?
Thank you, Governor. Thank you for your leadership. Good afternoon, everyone. I'll add my voice in hopes that everyone is safe throughout these weather events, and also to remind people what the Governor just mentioned. 4 out of the 5 fatalities we've had so far through these storms were related to driving in hazardous conditions. So just ask again for individuals, if you don't have to be on the road the next couple days, please don't. And if you do have to be on the road, just be very humble about how dangerous it can be with the rain and the wind. Very honored to have Dr. McCormick from Our Lady of the Lake here. Thank you so much for being here, as well as Teresa Sokol, our acting state epidemiologist. I can tell you, Teresa is really one of the big reasons why we've had such good data guiding us throughout these 14 months. She works harder than just about anyone I've ever met. And we're so very honored to have her in the Department of Health, and particularly here to talk about the vaccine in children. And specifically to have Elise here. And Elise, I want to thank you for volunteering for the vaccine trials. It is because of individuals like you that so many other people can avail themselves of these life-saving vaccines, because people like you volunteer for a trial. So thank you. I'm looking forward to hearing what your experience was like, but thank you sincerely for the contributions you made. We are very excited to continue to advocate for adolescents age 12 and up, really, but now 12 and 15 in particular, to get the vaccine. This was made available last week, and it offers a great opportunity to protect individuals in that age group, to protect their family members, because we know individuals in that age group can spread the virus, even if they themselves don't get that sick, and to get everyone back to normal quicker. Looking forward to, I know Dr. McCormick will talk more about that, but this is really a great opportunity for the state. It is clear that the Pfizer vaccine in individuals aged 12 to 15 is safe, it's effective, and it really protects, again, not just that child, but the family as well, because we know that individuals of that age, even though they're not likely to get very sick, although sometimes they do, they can effectively spread that virus to other people in the family who might get more sick. So this is really a tremendous opportunity. Today there was a letter released written by myself and a group of leading pediatricians throughout the state advocating for just that, speaking to the safety and the efficacy of the vaccine in individuals aged 12 to 15. It's important to hear from leading pediatricians, because I can tell you pediatricians have one thing at their heart what they show up to work to do, and that's to care for and protect children. I can tell you that's exactly why Dr. McCormick is here today, is to help children be health and safety. And to hear pediatricians from LSU New Orleans, LSU Shreveport, Tulane University School of Medicine, Ochsner Health, and Our Lady of the Lake be joined by the entire chapter of the Louisiana chapter of the American Academy of Pediatrics and advocate for vaccines is a very, very strong statement. So I'll ask people to pay attention to that. And really, if you do have questions about the vaccine, particularly in adolescents or kids, talk to your pediatrician. That's the best place to start. I also want to say this is the first time that we have the pleasure of briefing you without masks on as we enter the room, and many people in the room don't have masks on, and that's as a result of the guidance that the CDC put out last week and the Louisiana Department of Health quickly adopted. We're excited about this because it speaks to what we know about the vaccines right now, and that's that not only do these COVID vaccines protect the individual, greatly reduce their chance of getting sick from COVID, they also greatly reduce the chance that somebody who is vaccinated will inadvertently spread that dangerous virus to somebody else. The guidance is that if you are fully vaccinated right now, and fully vaccinated means 14 days or more since you've had your last dose, you do not need to wear a mask in almost all settings. Some settings you still do, like healthcare institutions, hospitals and clinics, on public transportation, and so forth. But outside of a select number of settings, you do not need to wear your mask. Number one, this only goes to individuals who are fully vaccinated. If you are not yet fully vaccinated, you still are liable to unknowingly spread the virus to somebody else, and you still should be wearing a mask when you are in indoor spaces around other individuals. Obviously, there's not a great way to check that, so like we do for many other things in Louisiana, we're going to rely on everyone being a good neighbor and looking out for one another. But just know that if you are not fully vaccinated, you still run the risk of transmitting this virus unbeknownst to yourself to somebody else, and you still should be wearing a mask. But for everyone who is fully vaccinated, 14 days out from completing that series, this is a big vote of confidence in what we know these vaccines to do. That said, if an individual, despite being fully vaccinated, believes that they are at higher risk themselves, if they have a certain medical condition that puts them at higher risk, if they have an immunodeficiency that might perhaps render the vaccine less effective in them, and certainly in consultation with their doctor, they absolutely can continue to wear a mask, and we should be very supportive of that when we see it. As the governor said, the vaccine rollout continues to go well, although we really encourage more people to get vaccinated. We know how effective these vaccines are. We know how well they prevent the spread beyond that. We currently have completed the vaccine series in about 30% of the state's population and 71% of everyone 65 years of age and older in Louisiana. Those are good numbers, but as the governor said, we know we can do better. And why wait? Why wait till someone gets sick? The time to get vaccinated, the time to go out and get your shot, choose to get your shot, is right now. I'll run through quickly the numbers of vaccine that we are being allotted by the federal government for next week, and then talk a little bit about what our ordering history has been. So we're being allotted next week a total of 120,910 first doses of vaccine. But as has been the case for the past 4 weeks, we're in all likelihood not going to need to order all of those. We're at the point now where we're not using all of the doses that have been made available to us by the federal government. So to date, we currently have ordered 88.7% of all the vaccine doses made available to us by the feds. Of those doses, 99.7% have been delivered in-state, are currently in-state, and of those, 77% have been administered or are in people's arms. We continue to very closely track breakthrough cases, and these are the very, very small minority of cases that do happen in individuals despite being fully vaccinated. No vaccine is 100%. Very, very close with these, but no vaccine is 100%. And that's one of the reasons why it's so important for more people to get vaccinated. To date, in Louisiana, we have had 810 breakthrough cases, or 0.058% of everyone who's fully vaccinated. Of those 810 cases, 47 individuals have been hospitalized, or 0.003% of everyone fully vaccinated. And of those, unfortunately, 15 individuals have passed away from COVID, or 0.001% of everyone who's fully vaccinated. We'll continue to track these cases. It's a very, very, very small minority of individuals who are fully vaccinated. Taking a step back and looking at what the virus is doing across the state, we're holding more or less flat, and we have been so for the past few weeks now. Percent positivity this week went up just a little bit from 3% to 3.4% on a state level. Regionally, it went up in 8 of 9 regions, and it went up in 44 of 64 parishes. The incidence or the number of new cases coming in is essentially flat, as is the number of people hospitalized with COVID. We currently have 311 individuals hospitalized with COVID, of which 27 are currently on mechanical ventilators. We've been below 350 hospitalized COVID patients throughout the state since the beginning of April 2021. We've been very steady with that. And I'll tell you, not since really the beginning of the pandemic, we had our first spike 14 months ago, have we been below 500. So being below 300 for about a month and a half is very, very encouraging, and evidence that the initial part of our vaccine campaign, when we were strategically targeting vulnerable individuals with vaccine, has been effective, because we've been able to keep our hospitalized number relatively low since that campaign started. That's good news. As the governor said, more progress can be made. And for every patient that is hospitalized, I'll tell you, about 10% of them are going to require mechanical ventilation. That is an aggressive intervention. And of everyone that gets put on a ventilator, about half are not going to survive that hospitalization. So every single life here is important. And that's one of the reasons why we are so eager to encourage individuals aged 12 to 15 to get vaccinated, because we know every life is important, and we know that those individuals, even if they don't get that sick themselves, which they still can be effective vectors and spread that vaccine to other people in the family. I'm going to pause here and take a few questions before we get to our guests. Okay. Very easy. Very, very honored to have Dr. McCormick from Our Lady of the Lake Children's Hospital here. He has a lot of expertise, and please listen closely. He knows this subject matter better than almost anyone else in the state, because it's this area of specialty. Dr. McCormick.
Thank you, Dr. Cantor, and thank you, the Governor's Office, for having us here and giving us this platform to speak here today. I'll tell you that as a practicing allergist and immunologist, I do have the privilege and honor of seeing a lot of children who suffer from recurrent infections, who have immunocompromised states, and who have other chronic conditions which can predispose them to illnesses. With that said, though, I nearly universally recommend that if the vaccine, the COVID-19 vaccine, and in this case, the Pfizer vaccine, is available, that they should avail themselves to it. I will say that looking at children, there's about 3.9 million children in the United States who've come down with COVID-19, a little over 16 to 17,000 who've been hospitalized, and to the best of our knowledge, about 300 or so have died. Another saddening component about that is that about 75% of those children who have died were children of color. And that's a big deal, and how it has been disproportionately affecting our communities of color and also touching our children. And so I bring these statistics up because we want to make sure you have all available knowledge out there to make your formal and informal decisions with regards to making your children avail themselves for the vaccine. So before I answer those questions with regards to side effects and its efficacy, just like what was so eloquently mentioned previously, this is a very, very safe vaccine and it's very effective, but nothing is perfect. We have to make sure that we stay vigilant. We have to make sure that our parents, our neighbors, and our children all kind of play their part so we can get our lives back to normal. And there's a significant amount of a psychological toll that this virus has taken on our families, on our individuals, and our communities. And we want to make sure that as far as the vaccine is concerned, you avail yourself to it because it's one of the few tools we have that's effective against putting a person in the hospital or maybe even taking their life. So moving on, I'd like to answer, there's some frequently asked questions I think that might be shown on the screen here. And so one of the questions is, are the vaccines safe for children? It's just like what was mentioned previously, that they more than certainly are. I mean, we had to look at quite a bit of data to determine that children, when I'm talking about children, I mean 12 to 15 years of age, had the same amount of side effects, if any, as was seen in 16 to 25 and older individuals who participated in the trials. I mean, we're looking at things like fever, maybe some degree of fatigue, which is one of the more common complaints either after the first and more so after the second vaccine. But I would like to remind you, just like with our infants receiving their child immunization series, they will have fever, they will feel fussy, they will feel disturbed and have restless sleep. And what was mentioned previously as well, the immune system is a wonderful thing. And so when it is revved up, for some people, they feel awful. For others, it's not so much. And just because you don't develop fever or fatigue or have those findings that kind of associated with a vaccine or your immune system kind of kicking into overdrive, it doesn't mean that it's not working. It's just a variability of the response. Next question. So how effective the vaccine is for younger groups. So when they did the study, one of the pivotal studies, it was about a little over 2,300 individuals with 12 to 15 years of age. We looked at them and kind of split them into two groups. One will receive the series of the COVID-19 vaccine. The other group received the placebo. The group that received the vaccine did not have COVID-19, and the placebo group had about 16. So that's nearly 100%, if not 100% effectiveness with regards to preventing COVID-19. Now, that was a study that was split. And what was mentioned previously, like the unfortunate people who've had vaccinations and who've had illnesses, and that extremely unfortunate group that have passed. Nothing is universal, but when you have something that is vaccine preventable in the larger sense, we do not want to let perfect be the enemy of good. Like I tell my children, a 95 is an A, just like 100 is an A. So it does the job. Next question. Do the kids need the vaccine when they've been affected by the virus as much as adults? The answer is yes. I mean, our children go to school. We would like them to go to school with less restrictions over time. They're going to be around some of our vulnerable populations and around adults. And so they can catch this virus. And we have seen children as young as 16, 17 months have COVID-19. And like Dr. Cantor mentioned, we've seen children pass away from this virus. And some of them have had long COVID symptoms and a lot of what we call sequelae, or signs and symptoms that are after an actual infection. These are not things that we want for any of the children. And so once we have that 12 to 15 population vaccinated, we can feel a little bit more comfortable that we're moving towards herd immunity, which is so difficult to achieve, but that's our goal. So I think I would stop right there and maybe ask if there are any additional questions that may come about that I can. Yes, ma'am. 75% of the children. So the question is going to repeat which children, which population statistic who had died with COVID-19, and that was nearly 75% of those who had passed away, of those deaths, were children of color. I don't think we have a clear understanding of it. We do have some very good prevailing theories that sometimes it's access to care, and when when they're disproportionately affecting the adults that live with children, second and third generation families living in the same households, things of that nature. And so nothing that's completely race specific, but again, we know that people of color typically have been described as living in disadvantaged situations and have been in situations where it's been a little bit difficult to access care or being treated with respect. And so they're going to be hit as a much more vulnerable population. Any additional questions? Thank you, and thank you for having me, and make sure we get those children vaccinated.
Hi, everybody. I'm Teresa Sokol. I'm the acting state epidemiologist for the Louisiana Department of Health. Is that better? Okay. First, I'd like to thank Dr. Cantor for his very kind words about my work, and I'd like to take this opportunity to sort of share that credit with my team. Very lucky to have a group of very talented and very dedicated epidemiologists and support staff who work tirelessly to produce this information and these data that we share publicly. So I'd like to thank them for all the work that they do. So I'm very happy to be here today to talk about COVID vaccines among adolescents. As you can see, it's a subject that's very near and dear to my heart. And I guess I'm here wearing two hats today. One is an epidemiologist and one is a mom. So I'll sort of start off as an epi, talk about that perspective to begin with. And I'll share with you that when I first started out as a very young epidemiologist, one of the first investigations that I worked on was related to a case report of a very tiny baby that unfortunately died of pertussis, of whooping cough, which is a vaccine-preventable disease. And this baby was too young to have received the vaccine, was not eligible yet. But this child was infected because those around her were not well protected. And this left a very lasting impression on me very early in my career. And over the next almost 20 years, as an infectious disease epidemiologist, I have pored over data. I have collected innumerable case reports related to vaccine-preventable diseases. I've conducted vaccine-preventable disease outbreak investigations throughout the state. And what I have learned from these experiences is really that vaccines are very powerful at preventing disease among individuals, for individuals, and then also helping to prevent disease among individuals throughout the whole community. And so, as you can imagine, when I became a mom, it was always very important to me that my kids were vaccinated with every available vaccine as soon as they were eligible. And COVID-19 is no exception. I have been anxiously awaiting the day when it would be available for my kids. And in fact, I had this discussion just last night. I was giving a presentation about COVID-19 in Louisiana. And of course, I talked a little bit about what we're starting to see with the positive effects of the vaccine and how we're starting to see decreasing trends with regard to cases and severe health outcomes, particularly among those groups that are most highly vaccinated in our state. So this was an important focus of the talk that I gave. And after I was finished, a member of the audience came up to me. She sort of, and these were healthcare professionals, and she sort of quietly approached me, and she wanted to ask me a question. And she said, "Do you have any children?" And I said, "As a matter of fact, I do. I have a 10-year-old son, and I have a daughter who's almost 13 years old." And she said, "Well, are you going to vaccinate them?" And I told her, "Absolutely." I said, "In fact, now that you bring it up, I've been so excited. I'm so confident in the safety and the effectiveness of these vaccines that I've actually enrolled my daughter in a vaccine trial." And of course, as an epidemiologist, I believe in scientific advancement, so that was an important component to me as well. But what it really boiled down to was that I wanted my daughter to have a shot at getting the vaccine early. We knew that the vaccine to placebo ratio was 2 out of 3, and I thought, okay, she has a 2 out of 3 shot of getting the vaccine early. And that's really what I was most interested in, because I knew that the earlier she got the vaccine, the sooner she was going to be safe. And that's what was most important to me. So I told this woman who approached me, and she shared with me that the reason that she had asked about it was because she had 2 daughters who were young adults, and she wasn't sure if she should vaccinate them. And she wanted to know what I would do with my own children. And so I said to her, absolutely, vaccinate your daughters. I understand that you have questions because it's new, but vaccinate them. That's what I would do. That's what's going to keep them safe. And that's what I would say to all parents who are unsure about the vaccines, who still have questions. I would say vaccinate your sons, vaccinate your daughters. This is the best way we have to keep them safe, to get them doing what they love again, and to let them be kids again. And so it was just sort of a nice conversation to have, and one that questions that I think a lot of parents have. So I think it's a nice opportunity for us to be able to talk about this subject. And now I would like to see if Elise would like to maybe share some information about her experience in the vaccine trial.
Yeah, of course. So it was actually a really interesting experience for me because it's never really something that I've ever done before. But I was really excited to try this because I knew that it would have been really important to researchers and scientists and doctors. And yeah, I did have some side effects. The first day it actually wasn't that bad. My arm was just kind of sore and red. But after I got the vaccine, or after the second day of the trial,
Second dose.
Yeah, the second dose, I felt a little bit worse. I ended up waking up in the middle of the night not feeling great, and I just didn't really feel myself, but it was really interesting because I felt a lot better the next day. And it's just like after all that, I still feel really grateful that I was able to contribute to this really important study. And now that I am almost positive that I have it, I can now say that I can protect myself and then also other people, and it's a feeling of relief.
So I'd also like to ask Elise to maybe talk a little bit about why you think it's important for kids your age to be vaccinated.
Yes, of course. So I definitely think that a main reason is obviously keeping them from getting sick and keeping yourself from getting sick. But another reason why I think that it's really important is for people's mental health, because I know that kids and teens, a big part of their life and how their brains are wired to work is by socially interacting. And I actually have a friend, she has some troubles with her immune system, so she hasn't been able to go to school in over a year. And she just keeps on talking to me. She's like, Elise, I really, really want to go to school, but I just want to see people again. And it just breaks my heart every time knowing that there are millions and millions of other kids out there really, really wanting the same thing. But I just really think that it's important, and when more and more people get the vaccine, I think it'll be a really, really great thing to see people kind of come together again and be a community again, and hopefully get our mental health restored and just the community, and getting our physical health and mental health a lot better.
Well, personally, I think that was very well said. So we're happy to answer any questions you may have, but otherwise, I think that's our story. All right, well, thanks for giving us the opportunity to talk.
Thank you, Dr. McCormick and Teresa and Elise, and especially you, Elise, for sharing your story. And I don't know if it was clear from what she told you, but she hasn't yet been informed for sure whether she received the placebo or the vaccine. So when she said she was pretty sure she got it, what she was talking about was the vaccine, not COVID. I just want to make sure that that's very clear. But because she had the side effects that she mentioned, she's pretty sure that she got the Moderna vaccine in that trial, which has given her peace of mind, and that's really what she was talking about. But it also extends to Teresa and the rest of the family, and that's what we're trying to achieve here. And really the way through this pandemic, the way to more normalcy, the way to finally putting all this behind us is by people getting vaccinated. And now it is available for anyone 12 years old and older. And we're asking people to make sure that they do that. And if they're at all hesitant, even after the compelling testimony you heard today and the explanation given by Dr. McCormick, ask your questions. Go see your pediatrician. Go see your family physician. Call the hotline that I just talked about. This is really important. And everyone, regardless of age, please take advantage of one of the 3 vaccines that's available to you right now. Do want to remind everyone to please stay weather aware. We've got a number of hours left with this system sitting on top of us here in southeast Louisiana. It then will move west, not east, unfortunately. For those people in southwest Louisiana, it will be at least another day. Please know that all of the state emergency responders, whether it's GOSEP, the Fire Marshal, the State Police, Wildlife and Fisheries, National Guard, you name it, we are positioned, we're ready, we're communicating with all the local officials, but we need people to make good decisions. And please don't drive through water that is standing on the road when you don't know for certain that it's 100% safe to do that. Again, we lost 4 people in Louisiana this week that have been confirmed thus far because of the flooding. I happen to believe that this summer is going to bring not just less flooding, but a lot more sunshine, and that we're going to continue to get people vaccinated in better and brighter days are ahead of us. And I want to finish by thanking not only Teresa, who does a great job, and I have the pleasure of working with her quite frequently, but all the people at the Department of Health and all of our partners all over the state who are working incredibly hard in order to try to manage our response to this pandemic and navigate our way through it in the shortest possible time with the least possible loss of life and hospitalizations. And they are tremendously dedicated and talented public servants. And Elise, I hope you're as proud as of your mom as we all are. So with that, I will tell you that our next press conference will be Tuesday at 2, and we will then discuss the next proclamation, because the current proclamation will expire next Wednesday. And so we'll see you Tuesday at 2. Obviously, if the situation dictates and we need to have another press conference before then because of the weather or so forth, we'll be certain to let you know. With that, I will take some questions. Yes, sir.
You know, a number of governors have alerted the federal government that they are no longer going to accept the $300 federal unemployment benefits. I was wondering sort of where you are on this issue and sort of what will go into your considerations.
Yeah, well, first of all, thank you for the question. And I think it's about 20 states currently. Some, I think, have already turned them off. Others have just announced that as of a date certain in the future, sometime in July or whenever it is, that they intend to do that. I've not made that determination here. And I will tell you that we still have an awful lot of people in Louisiana whose livelihoods depend upon the availability of jobs related to tourism. And we know that tourism is not back. And until tourism is back, their jobs are not going to be back. And so I'm reluctant to prematurely lift those enhanced federal unemployment benefits, especially if we don't have the benefit of a study that is particular to Louisiana to inform that decision. So what are the pros and cons as it relates to our state and the situation here? And I've instructed Secretary Bel Edwards this week to retain an economist to very quickly put that study together and bring it to me so that I can take it into consideration. I have received, I think it was yesterday, a letter from a number of business interests that have asked me to take a look at that and see whether I can agree to lifting those benefits early. Right now, we know that they expire on September the 6th. We know that young people, Elise and others, will be going back to school sometime in August. And we know that the summer is the slow period historically for tourism, and we know that tourism hasn't restarted. So all of those things will have to be taken into consideration. We'll be making a decision and making an announcement. I'm not prepared to announce today one way or the other. But I can tell you it's not something that we're going to do prematurely. It's going to be something that we're going to be very deliberate about. Yes, ma'am.
We're seeing a couple other states provide financial incentives for people to get the vaccine, either gift cards or obviously the lottery in Ohio and now Maryland, I think. Is that something you're considering?
We are considering lots of things, including incentives, and we haven't made a final decision. I have a weekly vaccination update where I have a Zoom call with Dr. Cantor, and Teresa's already on it, always on it, and a number of other officials. And we have started to discuss incentives, things that we can do. And we've not yet made a determination, but I would bet you that coming up pretty soon, you're going to hear that we're going to offer some things to make sure that people more people take advantage of the opportunity to be vaccinated. But we haven't made a decision exactly as to what that's going to look like or when. But I think you're going to hear something pretty soon. And I don't want to get ahead of myself, because there have been some other states who did that, and then they had real trouble trying to put together the incentive program that they prematurely announced, and I don't want to do that.
Is the lottery on the table or other?
I just said I don't want to do that.
I understand.
Thank you. Yes, sir.
Governor, the Associated Press released that Bodycam and surveillance video of the death of Ronald Green. What I want to know is why exactly did state police not release this video when the incident happened 2 years ago, when they did promise transparency, and what is your role involved in this situation?
Well, the state police didn't release it because the DA asked that it not be released before the investigation was concluded, and then subsequently the U.S. Department of Justice initiated an investigation and made the same request. And as you probably know, we were getting requests that the family and the family's lawyers and some other interested individuals see the video. We were able to make that happen. I directed that happen, and I think it was September of last year when Mr. Green's mother and sister came in, their lawyers and some others, and we were able to show them the video at that point. However, then and now, the entities that are doing the investigation, U.S. Department of Justice and the district attorney, haven't yet completed the criminal investigation. They've renewed their request that the video not be made public, and that's why the state police hasn't done it. I fully expect that as soon as they are told by those agencies that they can release the video without jeopardizing the investigation, you will see everything there is to offer.
I do want to know what your role in through this situation now that it's starting to unravel more.
Well, as a governor, I appoint the superintendent of state police. He works for me. So one of the things that I've done in my role was to make sure that even though the state police had been asked not to make the video available to the public, that it was available to the mother and to the sister and to their attorneys. And I was able to meet with them that day in September. And so my role is to continue to be the governor of our state. But it also means that I have to be mindful of the investigations that are going on, and you don't want to do anything that might interfere with those investigations or jeopardize some decision that may be forthcoming and may not, because I can't speak for them about whether there's going to be a criminal prosecution.
Last question.
I've been over here already. We'll stay for each of you.
Do you happen to know how many people have started reporting damage from the flood?
Well, I had that information this morning. I can get it to you. I know that it's hundreds. that have been reported primarily in Baton Rouge and in Lake Charles. In Lake Charles, it was a little heavier, and it's something like about 400 families in Lake Charles and 300 in Baton Rouge. But this number is changing every hour because families can go to damage.la.gov and report their damage. And so it's a very fluid situation. It's continuing. And by the way, the rain continues too. And so we're going to see this play out over the next couple of days. Yes, ma'am.
And are there any particular demographics who are appearing to be more hesitant to get the vaccine, and what is the state doing to reach those groups?
Well, I will tell you that we have a very robust campaign, Bring Back Louisiana, where we have enrolled all sorts of partner organizations around the state, faith-based communities, business, nonprofits, you name it, with a particular emphasis of late on medical providers. Because we believe that at this point in time, and studies and polls show this, if individuals today remain hesitant about getting the vaccine, there is a very good chance that me asking them to do so will make little difference. And so we know that the persons who are most trusted are pastors and doctors. And so we're really trying to engage pastors and doctors in this and make sure that every doctor-patient encounter that happens in the state of Louisiana, when they have a patient who is 12 years old or older, includes a conversation about being vaccinated. And if they haven't been vaccinated and they want to be vaccinated, we want, to the greatest extent possible, for that vaccination to be given on the spot so that it is convenient as possible. And we have outreach efforts to all of the communities in our state, white, black, Hispanic, other, urban, rural, Republican, Democrat, you name it. There are specific outreach efforts that are ongoing. We have events that are scheduled in various communities in each of our 9 Department of Health regions, including more events that are happening today. This weekend. And then we're trying to make it as easy as possible. So in the state of Louisiana, there are more than 1,500 places where you can get your vaccines today. So it's a very robust effort, and it's one that we're going to continue to grow and to refine. And we are more than willing to learn from other states and see what has worked there, but what best practices have emerged. It's one of the things that benefits us when we have our weekly calls with the White House and all the governors and people from the CDC and so forth, is we get to talk to one another and figure out exactly what's working out there. But the hesitancy is, we always knew we would get to the point where we would have more supply than demand with respect to the vaccine, and that we would have to overcome some amount of hesitancy in order to get where we need to be to truly put this pandemic behind us. But it is safe to say we got to that point much sooner than we wanted to. And so we're going to keep working. We're certainly not going to give up. And we're going to get to where we need to be, but we're not going to do it in the large numbers that we were seeing back in March. I think we peaked in the middle of March in terms of the vaccines that we've administered, and they sort of been going down over time. And they pick up a little bit when we add 12-year-olds, and they go down a little bit when you have bad weather. But you can say all that you want. We're not happy with the number of vaccinations that are taking place every day. And so we want to make it more convenient. We want to make it more available. And we have a particular emphasis on the social vulnerability index of the various communities, even by census tract in Louisiana. And one of the things that we have been recognized by Operation Warp Speed as being very good at relative to the rest of the country is our efforts to go into those communities that are most disadvantaged and to make the vaccine available and to actually administer vaccines. And so that's going to continue to be a focus of ours as well. And while we've done an awful lot of good work, and we have really good, dedicated people working extremely hard, we're not where we want to be. And I don't want to pretend otherwise. We're second to last among the states in the number of people who've initiated their vaccinations, and we are about 4th or 5th to last, or maybe 7th to last in terms of those who have actually gotten both shots and completed their vaccination series. And for some reason, the southeast region of our country is the one that's the most hesitant. And so we fare pretty well relative to our region, but we don't fare well relative to a comparison to the country as a whole. We've got a lot of work to do. But at the end of the day, we need people to make the decision to be vaccinated. And I'm praying that picks up. And I'll finish there by asking people to pray for our state in this time of inclement weather, with all the people who've already been adversely affected, and also with the pandemic that continues. And let's work together so that one day soon we can all celebrate the fact that over the previous 24 hours, not a single death has been reported. We haven't done that since the middle of March last year. And the pandemic is still very real. But more than at any point thus far, it is becoming more and more a matter of personal responsibility, because people, at least if they're 12 and older, they can protect themselves. And they can protect those that they love from being exposed to the virus from themselves if they get the vaccine. So we do need people to take advantage of this opportunity. So with that, I'm going to wrap up. We will see you all Tuesday at 2, unless we need to get with you sooner. And I invite everyone to continue to pray for one another and for our state, and then to have a wonderful weekend as well. Thank you.
And then, one day, the turtle got superpowers when she ate the radioactive lettuce leaf. And then...